Hi viewers, this is Kasturi Day and welcome to MouShauk. So today we will be discussing the third part or the last part of this chapter, that is disease cause and control according to class 9 syllabus ICSE. So before I start, I will request you to please subscribe my channel if you have not subscribed yet, or if you are a new viewer to my channel. And if you are liking the videos, press the like button and share with your friends so that they can also be benefited from these videos. And do meditate before you start your day. Okay, so let's start with the meditation first. Okay, so for meditation, you need to concentrate with a point of light, and that light is blue. You're feeling very relaxed, gently. You're energized to the dimension. The feeling is not just a transformation, but feeling that everything is very smooth and comfortable, feeling without any tensions and worry. But good in your studies, getting to the creation, application, and the interpretation for the community. Thank you for joining us. It's been here and see you for the discussion. So we have come to the viral disease. So what is virus? You should know that. Then we'll come to the viral disease. So virus, they are extremely small substances which are made up of nucleic acid. Okay, that is proteins, RNA, ribonucleic acid, and proteins. Okay, they are visible only through electron microscope. They are not visible to the naked eye. So they are only visible through not even ordinary microscope, but through electron microscope. Okay. They do not live freely in nature, but can only live inside other cells. Okay. They take over the metabolism of their host cells in their own favor, producing more viruses and usually killing the host cells. Kill the host cells. They take over the metabolism of the host cells and in their own favor, and they produce more virus cells and usually they kill the host cells. Okay? They can be cultured on living tissues in the laboratory and can be crystallized and stored in the shell. Okay? They are highly specific in attacking only one kind of host and only certain tissues. So one kind of virus attacks only one host, like that. Okay, and only certain types of tissues they are affected by a certain virus. For example, myxomatosis, the virus is fatal to the rabbits, but not they do not affect man. Okay, then whereas common cold or flu virus attacks humans and not the rats, like that. Okay? Next, we come to some viruses which are considered as the connecting link between living and non-living beings. Okay? They are considered as living as well as non-living. So they are connecting link between the living and the non-living beings. Okay? The features that support that they are living beings and the features which support that they are non-living beings. Let us try the difference between them. First is the support, the features that is supporting the living beings. They can multiply inside the host cell, which can be considered as reproduction. And a non-living feature is that they cannot respire, metabolize, or grow or multiply by themselves outside the host cell. If they are living outside the host cell, their metabolism, their growth, their multiplication is not done. They cannot even respire outside the host cell. Again, The living component is they command the hospital and behave like living beings. They command the hospital and they behave like living beings when they are inside the hospital. It may be plant, maybe animal, maybe human being. Okay, and another is non-living component is that they can be crystallized and made inactive for inadequate length of time. For unlimited length of time, they can be made inactive, they can be kept as in a crystalline form. Okay. Then common viral diseases are poliomyelitis, common cold, influenza, smallpox, mumps, rabies, etc. And World Rabies Day is celebrated on 8th of September every year. Okay. Louis Pasteur established that all infections are caused by germs. He established that all infections are caused by germs, and he was the first person to successfully treat a boy who was badly bitten by a mad dog by giving him an injection of weakened germs up to the 14th day. Till 14th day, he gave him injections and saved him from the biting of by a mad dog. Okay, he could successfully treat him from the rabies. Okay, so Louis Pasteur was the first person who did this. Okay? So during an animal bite, what should we do and what should we do not do? Okay? So first is do's. So we should wash the wound with soap and water. Apply some available disinfectants like povidone, iodine, spirit, household antiseptic. We should apply on that wound. Then contact a doctor for timely and appropriate treatment with anti-rabies vaccines and immunoglobulins. So for anti-rabies vaccine and immunoglobulins, we should contact a doctor after primary treatment in the home. That is, by washing it with soap and water, then applying any disinfectant. We should take him to the doctor for timely and appropriate treatment. This is do. Then what we should avoid? Don'ts is not touching the wound with bare hands. We should not touch the wound with the bare hand and not apply any irritants like soil, chili oils, or then herbs, chalk, betel leaves. We should avoid all this. Okay. Then we come to the viruses, viral diseases. First is HIV or AIDS. Okay. So this viral disease was first recognized in USA in 1981. In India alone, more than 2 lakh confirmed cases were found. Okay? And age group is 20 to 30 years more susceptible to these viruses. Okay? AIDS is the last stage of the HIV infection. HIV is human immunodeficiency virus. HIV is the virus and AIDS is the acquired immunodeficiency disease. Now, pathogen is human immunodeficiency virus, HIV virus. Then it's detected in the body fluids. Okay, found in the body fluids like in blood, serum, saliva, tears, urine, etc. An organ which is affected, each and every organ is affected if the immune system gets faulty. Here the immune system is affected mainly, which becomes faulty, and all the organs and in the later stage can be affected. Okay, the patient suffers seriously from even minor infections of other diseases. Okay, even cancer can appear if the immunity falls. Then incubation period is about 10 to 12 years, more than 10 to 12 years rather. And during this period, HIV positive can be the result. Okay. Most individuals die within 3 years after this disease has been diagnosed from the other infections like even the cancers also. Okay, in the AIDS, when fully developed, a person can get cancer also because his immunity is totally destroyed. Then symptoms are swollen lymph nodes, fever, night sweats, weight loss. Then mode of transmission mainly through sexual intercourse between a man and a woman. Other, when anyone is infected, anyone that is other man or woman is infected, then sexual intercourse is very dangerous. Prostitution is the biggest source. Okay. The safest relationship is wife and husband relationship. Only one single relationship that is. Common homosexual relationship with an infected person can also be the source. Okay? Then contaminated blood transfusion. This is another source of this mode of transmission. Okay? Contaminated blood transfusion. If the blood which has been given to the person injured during any surgery, if the person is injured or during any surgery, the person gets the blood. Okay, and that blood is contaminated with HIV virus, then the person can get infection or during thalassemia patients. Mother to child transmission also can occur through the placenta. Okay. Then injection needles, if shared by more than one person. There another is common during drug abuses. The person taking the drugs, I mean, he will give that injection to the same syringe is used by two or more persons. So that can spread the disease. So doctors use disposable syringes. Treatment is antiretroviral therapy, ART. It's a combination of HIV medicines which are applied, and it's known as antiretroviral therapy, ART. Prevention is to avoid the modes of transmission, that is sexual intercourse. When person is infected, if one of them is infected, the person should avoid the sexual intercourse. Then prostitution, the company with the prostitution people, that prostitute people should be avoided. The safest relationships should be entertained. Then contamination, that is blood screening, proper blood screening should be there before transfusion. If the mother gets this disease, then the doctor should give certain medicines, or the child has to be terminated if the person wants to avoid this HIV transmission. Or the injection needles should be avoided that should be not shared, or that is, we should use disposable syringes. Okay. Then World AIDS Day is celebrated on December 1st every year. Then we come to chickenpox. The pathogen which causes this viral disease, that is herpes virus, varicella zoster. Okay, varicella zoster, that is herpes virus, that causes the chickenpox. And age groups which are affected is common contagious disease. It is a common contagious disease which is mainly found in children. Also, adults are affected, but mainly in children. And mode of transmission is it spreads quickly by close contact with an infected person. Okay, the symptoms are highly irritating rashes appearing on the body, starting near the chest and back and gradually spreading into the arms, legs, face, head. The rashes appear first as pinkish spots and then rapidly changing to watery blisters. And the blisters gradually shriveling up and soon drying, forming scabs, which is this forming scabs. So this period, that is blister turning into that means they are shriveling up and then turning into scabs, drying into scabs. That period is very infectious, because when the scabs fall and the person, if the healthy person touches those by any chance, they get those scabs. Okay, that can cause infection to the healthy person also. Now, how it is treated is the infected person should take bed rest, keeping the rashes clean and dry. Do not prick the blisters. The blisters should not be pricked. May apply calamine lotion so that itching does not occur, to avoid itching, and even neem leaves can also be applied to avoid itching. Prevention is through vaccination. Children from the age of 12 to 18, they should be vaccinated. Okay, 12 to 18 months rather. 12 to 18 months, they should be vaccinated of live attenuated vaccine containing varicella virus for active immunization. Okay. And then good hygiene should be practiced by washing hands frequently. Okay. Then exposure to the people who have chickenpox, we should reduce that. We should reduce the exposure to the people who are having the chickenpox. Okay. If having the disease, they should stay at home until the blisters are dried and crushed out over. So that person should stay in the home till his blisters have dried and they have shredded off. Okay. Then we come to hepatitis. The pathogen here is hepatitis A, hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. So 5 types of hepatitis viruses are there. And organs affected is the liver, where the liver is inflamed. Okay. Mode of transmission is mainly through contaminated food and water, but contaminated syringes and blood transfusions are also responsible for the mode of transmission. Incubation period is hepatitis A takes 14 to 45 days to show its symptoms. Then for hepatitis B, 6 to 26 weeks, hepatitis C, 4 to 20 weeks, hepatitis D, 2 to 8 weeks, and hepatitis E, 2 to 9 weeks. Okay. The age affected, hepatitis A is affected by children and young adults. Hepatitis B, individuals of any age. Hepatitis C, generally in babies. Hepatitis D, young adults of 20 to 39 years. And in hepatitis E, in older adolescents and also young adults, say from 20 years of age to 44. Okay. Now, mode of transmission, mainly I told you, hepatitis A and E, they are hepatitis A and E, they are transmitted through contaminated food and water. E is mainly through water. And hepatitis B, C, and D, they are transmitted by contaminated syringes and transfusion equipment. Okay. Now the symptoms of hepatitis A, they have general symptoms of hepatitis, that is fatigue, nausea, stomach pain, vomiting, jaundice. Okay. So hepatitis A has fatigue, nausea, stomach pain, jaundice. Hepatitis B, they can produce cirrhosis of the liver and even possibly cancer. Okay. Then hepatitis C and D, they have high temperatures, headache, joint pain, loss of appetite with a general feeling of illness, nausea, and vomiting. And after 3 to 10 days, jaundice may develop with deep yellow urine and light-colored stool. Okay. And hepatitis E, they have general symptoms and also they have some itching skin rashes and joint pains. Okay. Now the treatment overall is the same, that is they should take bed rest until the fever subsides. High calorie diet should be taken with limited or no protein or fat. Okay. Washing hands after handling patients who are having hepatitis, the patients, that is the bedpan and the clothes, that should be handled in a proper way, and they should wash their hands after touching those patients' properties. Okay. Then prevention is vaccination for hepatitis A and B. Then their needles, the injections which they have to be given, that the syringes should not be shared. Okay. Then practicing good hygiene, washing hands with soap and water thoroughly. Then their infected persons' belongings, their personal items should not be used. Okay. So this much for today. Okay. Just a minute. Okay. Another, sorry, there's one table is there between difference between virus and bacteria. Okay. So virus is very small, which is visible only through electron microscope. But bacteria is a little larger and can be visible by light microscope also. Viruses are acellular, okay, and bacteria is single cell. So what is the difference between acellular and single cell? Single celled is they have the cellular structure in a animal cell or a plant in an animal cell, that is there is a bacteria cell is there, but virus they are acellular, that is they do not have a cell like that, okay? Because they can be crystallized also, no? So they have this non-living character also, okay? Then viruses have no metabolism, bacteria have metabolism, but when viruses stay inside the host, they behave like a cell, and there is also some metabolism inside the virus also. They take no food by any method, whereas bacteria take food by absorption. Viruses do not grow, do not divide outside the host cell, but inside the host cell they do behave like a cell. Okay, bacteria, they grow in size and divide to produce more bacteria. Viruses can be crystallized, bacteria cannot be crystallized. Viruses command the host cell to produce the virus, whereas bacteria self-reproduce, so do not command anyone. Okay. And viruses all produce diseases in man, animals, and plants. But some bacteria are harmless, and so some of them are useful, and also some are disease causing. Okay. So this is the end of this chapter and end for today. And in my next video, we will be discussing some question answers on this, some important questions. Okay. So till then, go through this and also the two other videos of this chapter. You will understand the chapter more. And if you still have doubts, please write in the comment box. You can also write if you want any improvement in the videos, okay, and if you want anything more, any subject more, also you can also comment in that, okay. So till then, have a good day and do watch and stay tuned so that you can be notified as soon as a new video is uploaded. So please do subscribe. Do press the like button if you are liking the videos, and do share with your friends so that they can also be benefited from these videos. And also, the last but not the least, that do meditate before you start your day. So thank you for joining and for the day.